Hello everyone, welcome to the second session of Hi Doctor. Today we have a plastic surgeon with us. She is Dr. Jayanti Ravindran, who is also the founder of Tamira. Tamira is one of the state-renowned plastic surgery center in Chennai. Hello ma'am.
Hello.
So today we are going to have a few questions we have from our viewers, we have it from our clients and from our patients with regards to liposuction. And liposuction is the topic of the hour. And we are going to discuss on points and topics on how liposuction actually works. So ma'am, before we start, can you give us an intro in terms of what is actually liposuction and how does it actually work?
Yeah, so anybody who wants liposuction or somebody who's trying to lose weight.
Okay.
So very rarely in Indian or in Chennai scenario, we get people who come to us saying that they want liposuction for specific body parts.
Okay.
So what everybody needs to understand is what is this liposuction process. So in simple terms, you're using a small tube or what we call as cannula to suck the fat cells out. That does not mean that you can use a cannula to suck the fat cells from head to toe.
Okay.
All the fat cells. It's not possible.
Okay.
So the fat cells are present in between the organs, it's present in between the muscles, it's in different planes.
Okay.
Liposuction can only suck out the fat between the skin and the muscle plane. So
Okay.
only in that plane, which clearly means it's basically a body contouring or body shaping procedure.
Okay.
So it is not an alternative to diet or exercise to lose weight.
Okay.
So somebody who's regularly, on a regular diet and exercising, but they're not able to get rid of stubborn fat,
Okay.
be it the abdomen, lateral part of the thighs, or arms, in specific areas. For them, the idea, if it's a very minimal collection of fat, there are alternative non-surgical procedures. For that, they should be the candidate with just a few centimeter of flap thickness, cellulite deposit. Anything beyond that, they become a candidate for liposuction.
Okay.
It's not a procedure where someone of 120 kilos or 130 kilos think that they do liposuction and become 60 kilos.
Okay.
So that is not like, liposuction should not be given as a choice to such patients.
Okay.
They become candidate for what is called a bariatric surgery.
Okay. So bariatric surgery is more on a diet, something related.
No. So somebody, let's say someone who's 110 kilos. So we measure the body mass index.
Okay.
So body mass index takes into account the weight according to the height of the individual.
Okay.
So if the body mass index falls under the obesity category, then those patients become high. There are only two ways. They will definitely have to lose at least 20 kilos, 15, 20, 25, 30 kilos plus. So they have two options to reach their ideal body weight. One option is diet, one other option is bariatric surgery. These are the only two options.
Okay.
To lose anything more than 25 kilos plus.
Okay.
So someone who's really motivated and who can, who has the willpower to follow a diet given by an expert dietitian, to follow that for a period of 6 months, 1 year, 1.5 years to reach the ideal weight. That's the best option.
Mm-hmm.
But if someone who's not motivated, who cannot follow that diet, if they remain at 130 kilos, they are going to develop, they may already have diabetes, or they will develop high blood pressure, they will have sleep apnea syndrome, and all problems related to obesity.
Okay.
So then their lifespan could be reduced because of that.
Okay.
So then they need to find a way to reduce that weight.
Mm-hmm.
So if you're not motivated and they'll start a diet, lose 5-10 kilos, then again they drop, they put back another 10 kilos, then it goes on and on, they never reach their goal.
Okay.
So such candidates, is better for them to opt a surgical procedure which is called bariatric surgery.
Okay.
So in bariatric surgery, basically, even if the candidate wishes to eat more, the body attains a satiety, meaning you say, even if you like a lot of, let's say someone likes a lot of rice and you serve with a plate of rice, beyond a small portion, they cannot eat because they reach the satiety. So that's the procedure they need to opt. So liposuction should not be offered as a solution for somebody who's trying to lose 30 kilos. Now let's say someone is about 15 kilos or 20 kilos overweight and they've followed a strict diet and they're losing the weight. During the process, they say, I've already lost 10 kilos, but my lateral thighs, my abdomen is not reducing. then we offer liposuction as a solution to help them get to their goal faster.
So what would be the weight which we can lose in a liposuction? Like if you're doing on a body part, how much weight can we expect to
Yeah,
lose?
so that's a good question. So liposuction does not translate like if you suck out, let's say, 5 liters of fat. So every time somebody thinks you don't suck 5 liters, we lose 5 kilos. I have candidates where I removed only about maybe 4 or 5 liters, but they followed a proper diet program after that and lost around 14 kilos.
Okay.
That's because along with liposuction, we've shaped, they also followed the diet. So it's not direct translation. We also removed mega liposuction like about 10 to 15 liters.
Okay.
So normally the safe limit we say is 10% of the body weight.
Okay.
So someone who was around 100 kilos, around 110 kilos, we, despite advising them bariatric surgery, they said no, they want. So we've offered liposuction. We've done about 10 liters, but they still lose only about 10 to 12 kilos.
So like how the law of science applies, the weight of the liter is equal to the weight the person loses, something like that.
No, it is because, see, when after liposuction, if you continue to keep adding calories,
Okay.
the calorie will be converted into fat.
Okay.
So once you do a liposuction, does not mean your calorie addition conversion into fat will not happen.
Okay.
It will happen. So, but once you've sucked out the fat cells that can store fat, and if you also reduce the calorie intake, and the body is metabolizing the remaining fat, the weight loss is much faster, and it is more dramatic.
But if you are eliminating fat between two layers of flesh, is it that the outer layer can become a little bit loose or something like that?
Yes, definitely that's possible. So it's like when you diet, they always say as you start losing weight, you try to do some toning exercise so the skin doesn't snap. Similarly, after liposuction, it is like following liposuction, sometimes there is a picture like an internal burn. So I normally assume like, let's say you pour hot water into the skin. When you have somebody develops a burn, you see the skin contracting. It will contract, right?
Yeah.
So when you do liposuction, similar internal burns happen.
Okay.
So that helps to tighten the skin to some extent.
Okay.
But if it's become too much, again scarring happens. But if it's mild, it helps to tighten the skin as well.
Okay.
But when the skin that's why if you do it for someone who's really obese, or even if somebody who's 120 loses weight by bariatric surgery, then they will also need that the entire contraction will not take place. So they will require some sort of skin removal.
Okay.
So we call it body lift.
Okay.
So that becomes mandatory.
Okay.
So
in liposuction also, is there any way by which we can contract the skin
that's
post
why I
the
said
surgery?
yes. So after liposuction, there are enough non-surgical methods. One of the best used technologies is radio frequency.
Okay.
So use radio frequency on a repeated interval. They're not one session. Keep using them to tighten the skin. So it's like you take a balloon. So when you take a balloon fresh, it is very small. Then you blow it up.
Okay.
Right?
Yeah.
When you blow up, basically it's elastic, right?
Yeah.
So you're breaking the elastic fibers and it's remain blown for, let's say, 1 day or 2 days. Imagine you let out the air. It doesn't become that small.
Yeah.
It still is lax and, the balloon. That's because the broken elastic fibers cannot contract back.
Exactly.
Same way is the way our skin acts.
Okay.
So if you remain overweight for a long period of time and suddenly you lose some weight, still the elastic fibers don't contract back. So you will have loose skin.
Okay. So is it like should I ask you how long does this liposuction procedure take?
So it depends on the part we do. Let's say if you're just going to do both your arms, so we call it as one area.
Okay.
It will take about 1.5 hours maximum.
Okay.
But if you're doing multiple areas, let's say you do arms and the back and then abdomen, so then you have to to do the back, the patient has to lie with the tummy down. But to do the tummy, the patient has to lie on their back. So a shift in position, change in, so all this takes time. So then it can vary anywhere between 1.5 hours to 4 to 5 hours, depending on the number of areas that we cover.
What would be the recovery time for this?
So if you do just one area, any liposuction, whichever area you do, there is some amount of discomfort and pain.
Okay.
Because it's like let's say you have an accident or a fall. You have a great, when you have a hurt, you do have some pain. So you will have some pain and discomfort. So in single area, the pain becomes bearable. So in a couple of days, you can return back to work.
Okay.
When you do multiple areas, it's accumulated pain, so pain is more. So you need about 4-5 days of recovery time to get back to work. When you do front, back, too many areas, sometimes 10 days for recovery, because when you do thighs, it will be a little difficult because it's, when you're walking, you feel some pain. So then it becomes 10 days of recovery time. So it depends on the number of areas.
Do they have to stay at the hospital during the recovery time?
Again, it's for when you do like it's on any aspirate, or when we're doing a liposuction, and the total amount sucked is about 4 liters or 5 liters, then the fluid imbalance is matched well within 6 to 8 hours, and they can be sent back home. But when you're doing about 10 liters or so, mega liposuction, then it's when the patient goes on, if they don't drink water and they get very sleepy and they don't drink water, they can get dehydrated and the volume loss, the olume deficit, and they can have giddiness. So such patients, when you do large volume, we keep them overnight and make sure that the fluid imbalance is settled before they get discharged.
In certain non-surgical procedures, ma'am, they say that these fat cells get removed during the procedure. Even liposuction, these fat cells get removed. So
liposuction is the only procedure actually which removes the fat cells from the body. Right? All other non-surgical, you're basically breaking down the fat cells in the sense, but the body has its own mechanism to remove dead cells. How much of it is broken down and how much of it is removed becomes very subjective. So you have different technology like cryolipolysis, you have radio frequency, you have ultrasound, and everybody, all these technologies, they claim they are actually breaking down fat cells. But liposuction, you put a tube and there is a negative pressure and vibration. So it disperses the fat, and the negative pressure actually sucks the fat out. So in any area where you do a liposuction, you remove X number of cells. The remaining cells can store fat. So let's say you're doing the abdomen, and in abdomen you remove the X number of cells. So when you put on weight, there are only less cells to store fat in that position, in that place. So that place will store less fat compared to the other area. That's why you hear many times, I did liposuction, after liposuction, put on so much weight, all in different places. That's because in the place where you've done liposuction, that particular fat. That's why liposuction becomes a very selective body concentric procedure. Let's say somebody who has saddlebags, that is more the thighs. You see, all of them, they have, no matter how much they try to cycle, exercise, the saddlebags don't go away. Then they become ideal candidates because they call it lipodystrophy. So they have a dystrophic fat, which because of their genetic makeup, they store more fat in their saddlebags. Whenever they put on weight, the saddlebags become a little more. So then, if you remove X number of cells, even if they put on weight, they put on weight proportionately, not just in saddlebags. So they become ideal candidates. So when you do selectively, then yes, whereas when you do radio frequency and all that, the amount of fat cells that's actually lysed and or broken down, and the fat getting absorbed and excreted is very, very subjective. So cryolipolysis is one of the time-tested technology, and a good platform, it works a little more predictable way than the others.
Can a person repeatedly do liposuction on a person?
So you must understand, liposuction is a surgical procedure, and we do more than one part. Anesthesia is given. First of all, your body should not be subjected to anesthesia every now and then. That's one point. Second, when you do liposuction in one area, you're damaging the lymphatic channels and the other, some amount of blood vessels and all that. So any wound heals by fibrosis. So you have a thicker fibrous scar tissue inside, and the lymphatic channels are disturbed. That's why I personally don't prefer to use liposuction machines, which can have other, in addition to a power or vibration, uses other technology as well. Because the amount of internal damage or fibrosis burns that's created can be more. So what happens is the remaining channels are good enough to drain away the dirty fluid, so that you don't get too many complications. When you go back and do a liposuction in the same area again, you are destroying even more channels. So the chance of the dirty fluid, or the we call it any other collection, the drainage fluid, from getting dispersed from that space, the chance of it becomes even more less, because more channels are destroyed. Till the time the channels are reformed, it will be difficult. So then the complications rates become more as you keep doing liposuction in the same area again and again.
Is there any timeline which they can have between two sessions? or say 2
So
times?
I normally advise when you're doing a general anesthesia, unless it's for emergency, you have to give at least 3 to 6 months recovery period for the body
Okay.
before you opt for another session. And it's preferably liposuction should be offered to someone who was you have a very specific goal. They want to lose certain cellulite in some body parts. They're regularly on a diet and they're doing exercise. Plus, we help them to contour that area, and they actually should not be coming back to us again for the liposuction for the same area.
Okay.
So, because they are the best candidates. So, otherwise, there's no point.
Okay. Ma'am, I have a few questions from a few of our clients. I'll ask you those questions. There's one question from one of our clients called Prerna, and her question is, while doing liposuction in the belly area, can it damage the internal organs?
So, yes, if it is not done carefully or it's not done by a trained specialist, there has been literature reports saying that the cannula, which is a tube, we are trying to suck between 2 plates. So you have a muscle plate and you have a skin.
Yeah.
So your cannula has to be parallel and start sucking. So when you go to the sides, you're actually bending. So you have to have different types of cannula.
Okay.
Otherwise, inadvertently, you can end up penetrating or perforating the internal organs.
Okay.
So there are remote chances for that. So you need to be careful. But otherwise, if you do it, so I normally, liposuction is like driving a car, right? All of us know that rarely you can meet accidents.
Yeah.
We all drive a car, 99.9% we reach home safe.
Okay.
Same way, liposuction, when done well, 99.9% you don't have a problem.
Okay.
But there's 1% chance, 0.1% chance that you can end up with complications. We've had instances of where we've had complications. So over a period of time, we try to analyze why such patients develop such complications. So when you do more and more cases, we realize that some patients, how you need to take even more extra precautions for some patients who have a tendency for these complications. But these perforation, it all comes because of inadvertent, passage of the cannula into deeper tissues.
Okay.
If you're in the right plane, that should never happen.
Okay. There's one more question, ma'am, from Anuradha. Her question is post-liposuction, since there's an insertion, will it leave some scar after?
So, where you're putting a coat, let's say somebody goes and does a keyhole surgery for whatever procedure, whether it's appendix or gallbladder. So, where they put the coat, we call them coat, you will have a mark on the skin. In very, very good quality skin, fair individuals, that's hardly seen.
Okay.
But usually the South Indian skin, we have a tendency to pigment in any place where there's an injury. So, even if it's a small 5 millimeter scar, if you don't look after the scar, it can be seen like a BCG mark.
Yeah.
So some small mark, if you go and look for it, okay, I had a coat here. Can I search for it? If you go and look for it, you can still find it.
Okay. But on an outer appearance, it's not possible.
Not grossly, because we try to conceal those where we make the punctures in areas which is normally covered by clothes, like your undergarments or whatever it is.
Okay. There's one question from Mr. Arnav. He says that I went for a gynecomastia treatment. I inquired about it and they suggested me liposuction for the very same. Why is it so that gynecomastia and liposuction, most of the time they come hand in hand?
Yeah, so the thing is, the gynecomastia, enlarged male breast, is because there is an accumulation of both the hypertrophy of the breast gland and accumulation of fat around that.
Okay.
So the liposuction is a procedure which removes the fat. So if the gold standard procedure to correct liposuction, gynecomastia, is a combination of liposuction. So it's like the enlarged male breast is like a bunch of grapes.
Okay.
So you have a stalk, central stalk, and you have a lot of grapes. So the bigger the bunch, the thicker the stalk.
Okay.
So imagine the breast gland is like a stalk. Okay. And the fat cells are like grapes.
Okay.
So you can remove the fat cells by doing suction. So when you do, the stalk is only in the center. So you basically remove all the fat cells in the surrounding area so that you know what is actually the amount of bulge that is contributed only by the gland.
Okay.
Then you remove all the excess gland. Okay. This way, when you remove the stalk, then the reaccumulation of that fat is not possible. Otherwise, if you do only liposuction, when the stalk is there, they can get recurrence again.
Okay. That answers his question very well. Then there's another question from Sangeeta. Her question is, she has double chin.
Okay.
Can she do liposuction procedure over there?
Yes, for double chin, liposuction can be done. But we also have alternative procedures for double chin. So you have basically there's an accumulation of fat. Again, a double chin, when there is a fat accumulation, then you can remove the fat by liposuction. But it's because if it's over skin sagging, let's say repeatedly somebody puts on weight, loses weight, then the skin sags. Then just the suction alone may not remove the double chin. It might need some skin tightening device as well. So yes, when because the amount of fat in a double chin is very limited, we also use cryolipolysis, we use injection lipolysis, and liposuction. All can be offered as a solution. But whenever we do liposuction and it's 1 day removal of the fat, then they need to wear some compression garment to redrape the skin. Otherwise, the skin may not tighten.
Okay. So, what would be how long will the procedure take if she has to do it for double chin?
Double chin is usually a day procedure. They come maybe 1 hour is the procedure time. But after that, she will have to have the compression garment. We tell them to wear the compression garment for minimum 3 to 4 weeks. So imagine after liposuction, you're wearing a garment. Then 3 to 4 weeks with the garment, you can't go to work. So then that becomes a long procedure, right? So that's why for double chin, rather than liposuction, unless they're doing other body part as well, doing a cryolipolysis in combination with injection lipolysis with tightening, skin tightening gives a better results than this with less downtime.
There's one more question from Basil. This question is, can you do multiple body parts at the same time?
You can do. I said you can do multiple body parts, but you need to have a safe limit. So we say 10% of the body weight to be sucked in one time. It's the maximum safe limit. Right? So let's say if somebody is 100 kilos, 10 liters of fat. So the 10 liters, sometimes somebody will have only a big thigh. So when you do a thigh with little seat area, then that itself you can remove 8 liters or so. So then you can't do multiple. So when you do multiple areas, it depends on the size of the individual. Someone who's just about 60 or 65 kilos, and we want to remove 5 areas, but they have small, one little brows, one little butt angles, little bit flatter thigh. Then you can do all of them in one session.
But as you're saying, man, that it is just removal of fat cell. So why is it so that there is this percentage you're saying of 10% of the total body fat? Because anyway, that particular fat cell is not being used anywhere else, right?
No. See, 10% is because there is a fluid shift. From your body volume, you are taking off 10 liters. Right? So once you take the 10 liters, the fluid that is circulating in our blood vessels sometimes tends to move into the space from where you've taken the fat. And they need to get back into the circulatory system or the blood vessels. Otherwise, somebody can become unconscious, giddiness, fall, and all this can happen. So that fluid shift, so drastic removal, suddenly if you remove like 15 liters, then that fluid shift, unless it's really well balanced, sometimes even when it's well balanced, there can be problem. So that is why it's a safe limit. It's to manage that volume loss. So volume loss, the body has to attain an equilibrium. So that takes some time.
There's one more question, ma'am. This is a final question from Avantika. Her question is, if I do a liposuction on my thighs, will it cause any difference in my walking pattern or something like that?
Yes. So whenever you do liposuction of the inner thighs, that because of friction, following liposuction, everyone is supposed to be wearing a garment, tight compression garment. So at least depending on the size of the area, anywhere between 6 weeks to 3 months, we advise them to wear the compression garment. So when you do the thighs, because inner thighs constant friction, and if they don't wear the garment, maybe for a period of 10-15 days, sometimes they have little discomfort. So that gives a discomfort. It's a little difficult during walking.
So that's answer the question. Ma'am, in terms of liposuction, what are the post-surgical precautions one has to take once he's done the procedure?
So we advise everyone the complications or after effects that you can get with liposuction. So there will be some amount of bruise, some numbness in the areas that your fat has been aspirated, and then you will have a little bit of sort of a contour deformity before the skin redrapes everything. So all this takes around the bruise takes around 3-4 weeks, and the numbness around 2-3 months, and to attain your final shape about 3 months time. In between, soon after the surgery, because I told you, we do infiltrate a fluid, reduce blood loss, and disperse the fat before we suck. So collection of such fluid in the space where you remove the fat. There can be what is called a seroma. If it's purely blood, it can be hematoma. So they need injection aspiration of this fluid, which can happen 2-3 times. And then once we aspirate, we ask them to wear the garment. So these are the after effects they should know. So if it's a small area, they know much of an after effect, they can resume work in 2-3 days. If they do multiple areas, no after effects, everything is okay. But then some amount of pain is there, so 4-5 days. But when you do too many areas, there will be some pain, discomfort, some recovery period. So they should be ready for a period of 10 days of recovery time.
Post which, how long do they have to wear the garment?
6 weeks, I told you, for limited sizes. But if your aspirate is big amount, at least about 3 months.
Okay. Any unique story on liposuction that you would like to share?
Liposuction stories, yes. What do I say? More commonly, it's gynecomastia. I would say someone with gynecomastia is what people undergo a lot of trauma. So I've had one gentleman who came to me and who said, I mean, he's never removed his t-shirt or shirt in public place or anything. He's basically comes from a Brahmin family where they do a lot of rituals at home. So he basically presented himself to be something like an atheist, so that he will not need be in a position or asked to remove his clothes. Okay. So he told me that even during his wedding rituals, he said that the garland needs to be brought. He made sure that he insisted the garland should be brought to his room before he gets dressed and comes out, so that the garland will cover the chest. Okay. So he felt so embarrassed, and he said that Angavastaram and the garland will help him to cover. So he basically carried this impression that this is some sort of a disease or a condition which he had felt so ashamed of, not even wanting to share with anyone. That's something that I hear a lot of these kind of stories when it comes to the gynecomastia. Liposuction specifically, people are very upset about their saddlebags. Some runners or some specific dancers, they have these saddlebags. No matter how much they try to diet and exercise, they are not able to get rid of their saddlebags. Okay. The other story that reminds of is we do have sometimes faced with complications following liposuction. We don't know reason why. So liposuction is not a question we take it for granted. We have to be extremely careful when we do these procedures, and it requires a lot of training and expertise to make sure that they get the expected results, and also they maintain it. So there's no point if they take all this effort and go through this discomfort and do a procedure, and you just don't diet and you come back after 2 years with putting back all that weight. So it's not, we are also not happy to have done that procedure. Neither are they happy because they put on weight. So it's very, very important somebody understands that it's not a replacement for diet or exercise. So we never advertise or we never say anybody should come because they want weight loss, they come and do liposuction. No. If you want to lose weight, yes, diet and exercise become prime. You want to reach your goal faster, we will help you. Okay. So we give you a kickstart, and then we help you to do a few, we get rid of some stubborn fat, so that you reach your goal faster. Okay. Otherwise, if you can't diet and exercise, the only option is to resort to bariatric. But even after bariatric, I've seen patients who regain weight. Okay. So even that after bariatric surgery, you have a tendency to regain weight. Okay. So the lifestyle, a proper lifestyle is the most important factor in achieving and maintaining an ideal weight. Okay.
Any age limit is there? Any age limit?
Of course, the age limit is more when you look at both the elderly individual. They come with other if they have other comorbidities like diabetes, high blood pressure, or they have previous heart problem and they stent and aspirin. So they have become higher risk when you do liposuction. Okay. But and we don't want to be advocating these aesthetic procedures for someone who is very, very young. Okay. So unless somebody is conscious enough. So recently, yesterday I had a consultation with someone who's just 17, 18 and who's obese. And they want to get to ideal weight. So I really didn't want to offer liposuction for them because at that age, trying to offer liposuction is not a solution for what she's facing. Okay. She's not able to control her lifestyle, and she's here to try and achieve fast. If I do that, hardly maybe for 6 months, 1 year, she will be in that shape. Again, she's going to come back. So why would I want to subject that body? Definitely that's not what I would like to do. So I've given them a clear option. Either they opt for diet, which is what I would like, but if that is not at all a solution, because she's so young and she's about 110 kilos, it's not appropriate, like she can't continue like that and she becomes 120 or 130 in a couple of years. Then she will become early diabetic, which will cause other, you can get complications. So then they will have to look at bariatric surgery.
Fine. So the most important lesson for the day is that diet and control over the food is very important.
Proper lifestyle management is the most essential. So we would like to do liposuction or any of these body contouring procedures for someone who actually follows a proper lifestyle management.
Makes it worth
Yes, obviously.
Okay. Thank you, ma'am.
Thank you
for
very
your
much.
time. So this is Dr. Ma'am talking to us about liposuction. You can subscribe to our channel to get more similar videos. We'll be back next week with another doctor to discuss another topic which you have queries on. Thank you.
Thank you.